Welcome to the Wellness Bridge. I'm Gary Chen, physiotherapist, CEO and founder of GC Integrative Physiotherapy and Wellness, broadcasting from the Gold Coast of Queensland. And today I want to start with something you have almost certainly been told by a friend, by a health magazine, maybe by a well-meaning doctor. If you're stressed and anxious, go exercise, go hard, burn it off. Now here's the thing, most of the time that advice is good, movement is medicine. I believe that to my core, but what if, for some of us in some circumstances, that particular version of the advice is not just unhelpful, but is actually making things worse? I hear it regularly in my clinic. Patients who went to a HIIT class to distress and came home feeling like their heart was going to jump out of their chest. People who've been training hard for months and their anxiety is higher than ever. There's a reason for that, and today we're going to look at what the science actually says, because the evidence points somewhere that ancient medicine has always known, and that most modern gyms will never tell you. Let me start with some basic biology, and I promise to keep it very simple. When you are stressed, genuinely stressed, your sympathetic nervous system is in charge. That's your fight or flight system. Cortisol is circulating. Adrenaline is up. Your heart is beating faster. Your brain is scanning for threats, like a smoke alarm that won't turn off. Now, what does intense exercise do? It activates more sympathetic drive. Your heart rate climbs. Cortisol rises further. Your body interprets the physical intensity as another stressor for a nervous system that is already working normally. This is fine. You stress, you recover, you adapt, you feel a release after. But for a nervous system that is already dysregulated, already stuck in that high alert state, adding more sympathetic activation doesn't create a reset. It deepens the pattern. A 2024 study published in Frontiers in Physiology looked at what exhaustive exercise does to heart rate variability, which is our best clinical window into how the autonomic nervous system is functioning. The finding was clear: exhaustive exercise shifts autonomic balance towards sympathetic dominance. More stressed, not calmer, more stressed. And for people with anxiety disorders specifically, research shows that high-intensity cardiovascular activity can trigger a physiological state that feels almost identical to a panic attack, because at the neurological level, it is almost identical. Now, to be fair, I am not telling you that intense exercise is bad. Moderate aerobic exercise is genuinely beneficial for long-term nervous system health. The nuance is this: intensity without recovery trains stress. The question is, are you recovering? And what actually helps your nervous system calm down when it needs to? Let me introduce you to the most important nerve in your body that most people have never heard of: the vagus nerve. Think of it as the superhighway between your body and your brain, running from the brainstem all the way down through the heart, lungs, gut, and intestines. It is the main channel of your parasympathetic nervous system, your rest, digest, and restore system. Here is the fact that genuinely surprised me when I first went deep into this research. Approximately 80% of the nerve fibers in the vagus nerve are afferent. They travel from the body up to the brain, not the other way around. What that means is that your body is constantly sending information upward, shaping what your brain perceives, thinks, and feels. Your nervous system is listening to your body before it listens to your thoughts. And here is the profound implication of that. How you breathe directly and immediately changes the signals your body sends to your brain. Your breath is not just air exchange. It is direct communication with your central nervous system. You have a physiological lever you can pull right now, in any chair at any moment, to change what your brain is experiencing. In clinical practice, we measure nervous system health through something called heart rate variability, or HRV. It is the variation in time between each heartbeat. Counterintuitively, more variation is better. A higher HRV means your parasympathetic system is actively counterbalancing your sympathetic drive. Your nervous system is flexible, resilient, responsive. A low HRV, a rigid metronomic heartbeat, is associated with anxiety, depression, chronic stress, and cardiovascular disease. So what does the research say is the most reliable way to increase HRV? Slow breathing. In 2022, a meta-analysis, which is the highest level scientific evidence we have, analyzed 223 studies on voluntary slow breathing. 223 studies, the conclusion was unambiguous. Slow, deliberate breathing significantly increases vaguely mediated HRV. Not sprinting, not HIIT, slow breathing. What is actually happening in the body? When you exhale slowly, you directly stimulate the vagus nerve. Parasympathetic fibers fire. Your heart rate drops. Cortisol decreases. The amygdala, your brain's threat detector, quiets down. A systematic review of 39 clinical studies confirmed measurable reductions in cortisol, perceived stress, and negative affect from diaphragmatic breathing alone. These are not soft outcomes. These are biological changes you can measure. Here is an analogy I use with patients. Your nervous system is like a fire alarm that has been going off all day. Intense exercise turns the alarm up louder. It accelerates the very process you are trying to escape. But slow, deliberate breathing is like walking calmly to the alarm panel and pressing the reset button from the inside. Here is where the Wellness Bridge does what this show was built to do. Because everything I just described in Western clinical language was understood in Eastern medicine thousands of years before we had the instruments to measure it. In traditional Chinese medicine, what we call the parasympathetic nervous system, that rest, restore, and digest state, is understood as yin energy, cooling, descending, nurturing. What we call sympathetic overactivation is the excess of yang, rising, hitting, depleting. And the ancient Taoists understood that health requires constant, fluid balance between the two. They even had a word for what happens when yang overwhelms yin for too long. Exhaustion, disconnection, illness. Tai Chi and Qigong were developed, in part as technologies for restoring that balance. And here is the key insight. These practices are slow deliberately, not because the people doing them lack energy, but because slowness is the medicine. The breath is coordinated with movement. The transitions are smooth and unhurried. The weight shifts are precise and grounded. And together, this combination produces something measurable and repeatable, sustained parasympathetic activation. A 2024 meta-analysis published in the journal Heart and Mind, a respected cardiology publication, examined the effect of Tai Chi and Qigong on heart rate variability. The results showed significant increases in high-frequency HRV power, which is the direct physiological marker of parasympathetic dominance. In other words, Tai Chi doesn't just feel calming. It shifts your nervous system into the recovery state in a way you can measure. For anxiety specifically, a 2023 network meta-analysis, the kind of study that compares multiple interventions head-to-head, found that Tai Chi significantly reduced anxiety with a standardized mean difference of nearly 1 full point. That is a clinically meaningful result, comparable to psychological interventions in some trials. When I introduce Tai Chi or Qigong to patients in my clinic, particularly older patients carrying anxiety, chronic pain, or fatigue, what I see consistently within 2 or 3 sessions is a visible shift. Shoulders drop, breathing deepens, the expression softens. That is not placebo. That is the autonomic nervous system doing what it was designed to do when we stop forcing it to do something else. The 4-7-8 breathing technique, which I am going to teach you in just a moment, has roots in pranayama breathing traditions that are more than 3,000 years old. Ancient Indian physicians understood empirically that extending the exhale calms the body. We now know why. A prolonged exhale gives the vagus nerve sustained activation time, driving HRV upward with every cycle. 30 centuries of human observation, confirmed by modern neurophysiology. If you want to take this to your doctor, here are the numbers. A 2023 randomized controlled trial found that 5 minutes of structured slow breathing produced greater mood improvement than mindfulness meditation. 5 minutes, not a special retreat, not a gym membership, 5 minutes of deliberate breath. A systematic review covering 58 clinical trials confirmed that regulated breathing practices produce significant measurable decreases in both physiological and psychological markers of stress and anxiety. 58 trials. That is not a trend, that is a body of evidence. And for those of you managing chronic pain alongside stress, which is so many of my patients, a 2025 meta-analysis found that breathing exercises significantly reduce pain and disability in chronic neck and back conditions. The mechanism is that slow breathing down regulates central sensitization, the nervous system's tendency to amplify pain signals via the vagal anti-inflammatory pathway. That is a profound clinical application that we are only beginning to integrate into mainstream physiotherapy. A note of balance, because I believe in honesty, slow breathing is most effective when combined with a broader mind-body approach. It is not a single cure, and if you are experiencing significant anxiety, chronic pain, or you are recovering from trauma, please work with your GP or a physiotherapist who understands this approach. These are tools. Use them with guidance. Let me give you 3 techniques. Simple, evidence-based, and you can start right now. Technique 1. The 4-7-8 breath. Inhale gently through your nose for 4 counts. Hold for 7. Exhale slowly through your mouth for 8 counts. The key is the 8-count exhale. The extended exhale is what drives vagal activation. Do 3 cycles. You will feel a shift. This is your go-to for moments of acute stress, before a difficult conversation, in a waiting room, or just before bed. Technique 2. The physiological sigh. This is something your body does spontaneously when it is overwhelmed. You have probably noticed it without knowing the name. A double inhale through the nose. Sniff in, then a short second sniff to fully expand the lungs, followed by a long, complete exhale. Research from Stanford identified this as the most effective rapid nervous system reset we know of. You can do it in any chair, in 10 seconds, anywhere. Technique 3. 10 minutes of Tai Chi or slow Qigong movement daily. I call this the neural tune-up. You do not need to master a form. You do not need equipment. Search beginner Qigong for seniors on YouTube. There are many wonderful guided practices. Move slowly. Let your breath lead the movement. Let your exhale be longer than your inhale. The slower, the more deliberate, the more benefit. And here on the Gold Coast, we are blessed. Take this outside, the ocean air, the morning light, the feeling of grass or sand underfoot. Your nervous system evolved to downregulate in nature. Give it every advantage. If you've been pushing hard and wondering why you feel more wound up, not less, now you know. Your nervous system responds to signals, not intentions. Give it the signal it needs. This is the bridge we built here. Ancient wisdom and modern science working toward each other, meeting in the middle. Thank you for being part of this journey with me. Remember, together we find balance in one.